This week on Marketplace, dirty hospitals.
Some hospitals are a real freaking disaster.
Canada's first undercover hospital cleaning test.
2 days later, there it is.
Insiders paint a not-so-pristine picture.
There was feces on the floor for more than 2 hours.
You think you're getting better, end up getting sicker.
This has to stop. This is Canada.
We look for answers.
Why isn't cleaning more of a priority if it's so crucial?
We're taking our hidden cameras into hospitals. Secretly applying a special gel used by some hospitals to test cleaning. See how it glows? Only visible under a UV light. If we come back 24 hours later and the gel's still there, it hasn't been cleaned. Cleaning is key to keeping deadly infections from spreading to patients. So, we gel areas that get touched a lot, places that should be cleaned often. We'll have the results later. To meet someone who knows too well why hospital cleaning's crucial, we head to the small town of Stevensville in southern Ontario, where Denise Ball lives.
Hello? Hi.
Last year, when Denise's husband Gary is in the hospital, she notices some questionable cleaning.
They would come in and wash the washroom and come through, and there was, in his particular room, a sink and a soap dispenser, and they'd be washing that with the same rag. And I thought, oh, this was a filthy thing to do. So after that, I just watched like a hawk. Recording now.
You point it down at the ground.
Gary's 63 years old when this video's taken last winter. A retired school teacher, active and healthy.
This is Gary, what he does when there's too much snow on the deck.
All that changes last April when he's admitted here at Niagara General with pancreatitis. He spends 3 days in a merge where he catches pneumonia before getting a bed on a ward. Soon after, Denise is told she now has to wear a gown and gloves to enter Gary's room.
So I put him on, and I went into his room and I said, what's going on? And he said, I don't know. They said my room is tagged because I have C. difficile. I goes, how did you catch that? He goes, I don't know.
Turns out, Gary was put on the same floor as patients who have C. difficile, a life-threatening superbug.
Hi, everybody.
How did he get
Well,
C. difficile?
Whoever came to help him, or cleaning staff washing those rails, I mean, that's how they explained to us how it could be caught.
Gary's got what's called a hospital-acquired infection,
So say bye.
a problem in hospitals across the country.
Outbreak. Health officials try to contain the spread of C. difficile.
Killed nearly 100 people in Montreal, and Calgary is also prevalent.
Doctors at Burnaby General says the rate of C. difficile infections is 2 to 3 times the national average.
In fact, 250,000 patients across Canada get life-threatening infections while in hospital every year. More per capita than the US, any other developed country. Up to 12,000 people die, the 4th leading cause of death in Canada. To get his take on how poor cleaning's playing out, we head to Toronto General Hospital to meet up with infectious disease specialist Dr. Michael Gardam.
Hi, Dr. Gardam.
Hi.
Erica, how important is hospital cleaning for infection control?
Hospital cleaning's huge. It's one of the most important things we have to control infections in hospitals. I can pass C. difficile onto a patient if I don't clean my hands, but they can also pick it up from the bed rails. That cleaning becomes absolutely critical.
And yet, across Canada in recent years, hospitals have cut the proportion they spend on cleaning. One way many are saving is by privatizing cleaners or their management. We tracked down a cleaning supervisor, a nurse, and this hospital cleaner, all risking their jobs to speak out.
They've really cut staff, and we don't have a lot of time to actually get done what we're supposed to get done in the day. We used to have one person to one wing of the hospital to clean, But now we have 3 floors to clean.
3 times the work in the same amount of time.
You don't get the time to actually move everything, the furniture, the proper time of letting the cleaner sit long enough. We should be taking more time to let that dry naturally, because you really need that time to let it disinfect.
Then there's the mopping.
The chemical solution in the mopping bucket is not being changed.
Why?
They don't have the time. They just simply don't have the time.
So they leave the same dirty water in the bucket and go to another room?
Yes.
Have you seen that?
It's common practice.
There's a shortage of cleaning supplies, too.
I've seen a cleaner mop the floor. So she's cleaned infected patient rooms, and then she's gone down the hallway cleaning because she didn't have enough mops to change.
Using the same mop?
The same mop.
In a non-infected room?
Yeah. And in common areas. She's just contaminated the whole area, so there's no area that was actually clean. It would all be classified as dirty.
I watched them washing quickly around, and I mean quickly.
How quickly did they
clean
the room?
Was, kind of up in the air. And
did they spend 45 minutes cleaning the room?
Oh gosh, no. 10 minutes, if that.
10 minutes?
Yeah.
For a room that's infected with C. difficile?
Yeah.
Hospital cleaning's not like any other type of cleaning. Surfaces have to be absolutely spotless, bacteria-free. So, to test how long it takes to thoroughly clean after a patient's sent home, we enlist a cleaner at this Toronto hospital to show us how it should be done. We time the job. To clean this room properly, just over an hour. But in reality,
how much time on average are cleaners getting?
15 minutes.
15 minutes.
That may explain this. This. And yep, that's a mouse. Another way privatized cleaning companies save money at some hospitals? After 3:30 p.m.
Just one cleaner in the whole hospital.
And you'd better hope there's not a cleaning emergency.
Recently, a patient had an accident. They had feces on the floor. We cleaned it up the best we could, but you still need somebody to come and pass a mop with the actual cleaning.
They had to wait 2 hours.
There was feces on the floor?
Yes.
For more than 2 hours until a cleaner could come?
Yeah. If it was somebody that had an infection, this would be sitting on the floor and the nurses are walking in and out of the room. So we'll be taking that to another room and all down the hallway.
We share what we hear with infectious disease expert Dr. Michael Gardam.
After 3:30, there's one cleaner for the entire hospital. The entire hospital.
That kind of day-night difference is very common, and it makes no sense. Cleaning a room, you would expect that to be able to happen 24 hours a day. And it has to happen 24 hours a day because the bacteria really don't give a damn whether it's day or night.
Yet look what our hidden cameras find in this room with a patient infected with a superbug. Smears on the wall that we're told have been there 2 weeks. And we hear basic equipment isn't cleaned properly either, like IV poles.
They're supposed to go to the dirty utility to be washed properly. Most times they don't.
These are IV poles that people hold on to, and they haven't been properly cleaned?
No.
Or sterilized?
No. They've just been wiped, surface wiped.
Same goes for commodes, even ones that have been used by an infected patient.
So the person who's infected has used the commode, and then somebody else has to use the same commode?
Yes.
It doesn't get sterilized in between?
No, it just gets wiped down by the nurses.
Does that kill everything?
No, it just kills the bare minimum, but you don't know what else is on there.
Check out these pictures taken by a patient's family in Ontario's St. Catharines Hospital last summer. Feces stuck to the wheels of this commode.
I visited hospitals all over Canada, and the variation is actually striking.
Shouldn't there be some standard of care?
Some hospitals are a real freaking disaster.
A freaking disaster.
They've been told to actually cut their number of housekeeping staff by outside auditors who are trying to help them balance their budgets.
So cut the cleaning staff?
Yeah, and frankly, when I was hospitalized, I was pulling out the disinfectant wipes and I was wiping down surfaces in my room.
Still fighting the C. difficile he picked up at Niagara General, Gary Ball is in and out of hospital.
The pain has subsided. Hopefully within an hour or so, I'll get the hell out of here.
He can't beat the superbug.
He just couldn't get healthy enough.
Because of the C. diff?
Because of the C. diff. And even the doctors there had said it was the complications of the C. difficile that caused all of this.
One night, he collapses at home, is rushed back to Niagara General.
And my sister-in-law was already there, and she shook her head no at me. And I just fell straight down. And this was not really true. Hi, Gary.
Do you think he was let down?
Oh, yes. Really let down. If it was the other way around, he would be fighting, saying, this has to stop. This is Canada. And people go into the hospital to get well, and you're having them come out and being sick.
When we come back, the results of Canada's first undercover cleaning test.
Holy cow. Oh.
We're shining a light on dirty hospitals. Canada's first undercover cleaning test. Remember that harmless gel we applied 24 hours earlier to places people touch a lot? We're checking to see if it's been cleaned off. If it hasn't, it will glow under our UV flashlight.
Tops look good.
Some of the gel has been cleaned away, but most surfaces we gel, here and in all the hospitals we test, haven't been cleaned. We show some of our footage to infectious disease expert Dr. Michael Gardam.
This is on a handrail just down the hallway from inpatient surgery.
So how long had that been sitting there?
24 hours.
Yeah.
Look at it all.
Yeah. So chances are nobody's cleaned that.
Is that a concern?
This is something that patients might be touching as they're walking down the hallway. Anything that's sitting in an inpatient environment like that that's been around for 24 hours is obviously worrisome.
Next, a visitor's room on an acute patient care ward. The door handle isn't cleaned. Neither is the light switch.
These are things people touch with their hands. Where do their hands go? Do they go to their loved one? So these are the kinds of things that we really focus on trying to have cleaned regularly.
Next, we go inside a washroom shared by 4 patients. Taps not cleaned.
Is it acceptable to you to see this in a patient's bathroom more than 24 hours later?
Shared washrooms need to be cleaned really well, at least twice a day. We worry a lot about washrooms, shared washrooms. I think they're probably one of the major ways that things are actually spreading patient to patient.
This was on a ward for infectious patients.
I would suggest you could probably find examples of this in pretty much every hospital in the country.
Denise Ball didn't just lose her husband Gary to a hospital-acquired infection. She lost confidence in hospitals.
I'm afraid to go to the hospital even today. You don't know what you're walking into.
In the weeks after Gary Ball catches C. difficile here, Niagara General Hospital and others in the region declare outbreaks.
More than 30 people have died in the Niagara region alone.
The province steps in.
The Ontario government takes over its largest hospital system because of an outbreak.
So, we head to this Hamilton hospital to meet the man appointed by the government to get hospital outbreaks in the Niagara region under control, Kevin Smith.
Hi, I'm Kevin. Nice to meet you.
Nice to meet you. Why are hospitals cutting back on cleaning?
I don't think they're necessarily cutting back. I think they're experimenting with new models of cleaning.
Well, we interviewed a cleaner who used to clean 1 floor per shift. Now she has to clean 3 floors per shift. How is it possible that she could be properly cleaning?
So obviously I don't know the place or the hospital or the individual, but let me...
It's one of your hospitals.
It's one of our hospitals, okay.
She says it's the same job, but less time.
That doesn't resonate with what I'm hearing in terms of how we're making investments, how we're bringing in new technologies.
Workers we talk to say they are overworked. They want to do a better job, but they feel that they are handcuffed. They can't actually do the job they need because they don't have the time, they don't have the resources, some of them don't have the training. Why isn't cleaning more of a priority if it's so crucial?
Yeah, I don't think you could make it more of a priority than it is currently at the Niagara Health System.
But workers we talk to say it doesn't seem to be.
So obviously I need the workers to be talking to me more than you, frankly, and I need to go back and figure out why would they feel that way, and I haven't heard that message. I have heard in some staff meetings that we're rushed. And that isn't for cleaners, it's for nurses, it's for doctors. Everybody's feeling rushed in healthcare.
But listen to this. One reason cleaners in particular are feeling rushed.
You get a lot of pressure from above to turn that room over. And one of the reasons that you have to turn it over is, I believe it's $500, is given extra to the hospital if the person's out by 11 o'clock or 2 o'clock in the afternoon.
The hospital gets extra money if they get a patient out of the room before 11 a.m.?
Yeah.
Seems hard to believe, but remember the uproar over hospital wait times?
Patients are kept on stretchers when they should be in beds, and in chairs when they should be in stretchers.
Some patients have waited so long that they've called 911 from the ER just to get medical attention.
Some provinces have come up with a plan to cut those waits, like BC, Ontario, where the hospital gets hundreds of dollars from the province for every patient it gets out of emergency and into a bed within a certain time.
How does that affect cleaning, this pressure to get a patient out of a bed?
I've had the patient come up, but the bed isn't cleaned yet. Nobody has been in there. So now you need this person to come and clean this bed because you had a patient in the hallway waiting for a bed. And that's when the beds get cleaned really quickly.
Do you think corners get cut?
Yeah, because I have a patient in the hallway, so they're not going to do as thorough a job as they're supposed to.
It isn't, oh, I just want to be mercenary and get a bit more money for the hospital. This money is to incent behaviors that improve quality of care.
But what sense does it make if you bring a patient in to a bed, so you cut the wait times at the expense of giving that patient a potentially deadly disease?
Absolutely. So by no means am I suggesting that in order to meet the target, should we skimp on our performance. And the target system isn't set up like that.
But the
Again,
nurses and the cleaners
perception,
say that there's a lot of pressure, that they have to turn the beds over, and it's rush, rush, rush.
There is a lot of pressure, but I would tell you that certainly while I've been supervisor, it's about providing high-quality, cost-effective care.
It's about something else, too. As cleaners scramble to prep beds for the next patient, guess who benefits?
The CEO gets a big bonus for his hospital being one of the tops in cutting wait times and moving people around.
The CEO is benefiting because of this and putting potentially patients at risk.
Yeah, I think that pay for performance in general doesn't work very well. What I would like to see is you can pay for performance, but I would like to see it based on a number of measures, not just wait times. It can't just be about how many you do, it also has to be about that you're doing them safely.
Kevin Smith's also a CEO for a group of other hospitals, so
do you get a bonus?
I do. All the bonuses are tied to metrics, and one of the metrics is what's your infection rate like? So if you got a really short wait list and a really big infectious disease bump, there is no bonus coming.
Smith's contract says he's eligible for an extra 15% on top of his salary. When we come back, a test on this CEO's home turf.
We have gelled this hospital.
Okay.
We're investigating how dirty hospitals can make you sick. Getting answers from the man appointed to clean up hospitals in the Niagara region after C. difficile outbreaks, CEO Kevin Smith.
An infectious disease expert we interviewed, Dr. Michael Gardam, has described cleaning in some hospitals as a freaking disaster.
I agree with Michael. I think that's true. He'll know that he's been at our hospital and said, you're doing a great job. You're doing exactly what I've told you to do. I'm not worried about the Niagara Health System. You're actually among the leaders of the province now.
Well, we took hidden cameras into the 3 largest hospitals in the Niagara Health System: Niagara General, Welland, and St. Catharines. First up, Welland.
This is a handrail that's right outside a patient's room who's in isolation. And where it glows, it hasn't been cleaned. So there it is.
A lot. I'm obviously very disappointed to see that. That is a less than optimal cleaning opportunity. We need to fix it.
A cleaner we spoke to said there used to be someone whose sole job all day was to go around cleaning off these high-touch areas, handrails, elevator buttons, door handles, and now we're lucky if those things get cleaned once a week.
So I would say if the standard is once a day, then it has to be once a day.
Next, we show him a public washroom in Niagara General, the hospital where Gary Ball got C. difficile. The support rail 24 hours after we applied gel.
See, that hasn't been cleaned.
No, you're right. Okay. So obviously, then you've got some data that we need to improve our performance.
And then we reveal
we have gelled this hospital.
Oh, okay.
Yesterday we came in and we gelled some high-touch areas in this hospital. And I'm wondering if you would like to come and we can take a look and see if it's been cleaned.
I would like to do that.
And so we head back to places we gelled more than 24 hours earlier.
What do you think we're going to find?
Well, I'm hoping we're going to find a great clean environment.
Some of the surfaces we gelled have been cleaned, but not most of them. First stop, a ward with highly contagious infectious disease patients.
See this?
Yeah.
We put this on more than 24 hours ago, and it hasn't been cleaned.
Concerning. Absolutely concerning.
And this is the handrail that patients grip.
Absolutely. You're absolutely right.
Next.
So here we are. This is contact precaution, so this is an isolation room.
Yeah.
And the railing outside of this room is
still not clean. And you placed it there yesterday.
Yes, more than 24 hours ago, and this was supposed to be
Our
cleaned.
standard is supposed to be cleaned every 24 hours. We have some work to do. Obviously, you've uncovered an opportunity for improvement. If it comes down to we need more cleaning, we need more cleaners, then we're going to have to go back to our budget table and say, what are we going to do less of to do this?
Back in Stevensville, Denise Ball is left only with memories and anger.
They just don't get it. And maybe until one of their loved ones that went in, and they can count a few months later and they're going to their grave. Maybe that's what will wake them up.